Some journeys aren't defined by a destination, but by their transformation. From passionate beginnings to defining milestones, the Pakistan Cardiac Super League became the heartbeat of academic excellence. Two pioneers joined forces once again to ignite the spirit of learning and leadership. What began as a challenge became a movement. In every round, a new hero emerged. In every team, a story was written. Now, the legacy continues as 16 elite teams step into the arena to prove their strength, their skill, and their synergy. Team LNH Pelicans, Team 𝐋.𝐍.𝐇 Tigers, Team BVH Cardinals, Team FIC Fighters, Team SICVD Thunders, Team AFIC Lions, Team PIC Hawks, Team Dow Dolphins, Team NICVD Kings, Team RIC Dreadnoughts, Team Looms Falcons, Team MIC Panthers, Team AQH Stars, Team BMC Strikers, Team HMC Stallions, Team PIC Warriors. Guided by the visionary stakeholders of the Pakistan Cardiac Society, steered by the Governing Council, the backbone of PCSL. Judged with fairness and integrity by our panel of expert umpires, and held together by the voice of reason and brilliance, Dr. 𝐏𝐚𝐤𝐢𝐬𝐭𝐚𝐧, our moderator, whose pivotal presence made this league a resounding success. Glory goes beyond borders. The winning team will earn a prestigious opportunity to participate in an international cardiology event. Mark your calendars, the battle for brilliance begins August 9th. Pakistan Cardiac Super League, Season 3, the ultimate test of knowledge. Powered by Wilson's Pharmaceuticals.
Bismillahirrahmanirrahim. Assalamu alaikum everyone. I am 𝐶.𝐍.𝐇 and it is my honor and privilege to welcome you all as we kick off for the third quarterfinal match of Pakistan Cardiac Super League Season 3, which is going to be played between 𝐻.𝐶 Stars and LNH Pelicans. FIC Lions and SICVD Thunders have already qualified for the first semi-final match, and winner of today's match will be booking their spot for the second semi-final match. Before we begin, this event as always is brought to you by Pakistan Cardiac Society in collaboration with Wilson's Pharmaceuticals. I would like to introduce the expert faculty members and umpires of today's match. We have with us the match umpire Professor Mohammad Ishaq Saab, Professor Abdul Hamid Siddiqui Saab, and Professor Amber Ashfaq Saiba, and more panelists will be introduced during the match. And last but not the least, I would like to introduce the voice of Pakistan Cardiac Super League. You all are familiar with the name Dr. 𝐻𝐚𝐤𝐢𝐬𝐭𝐚𝐧 Saab, and I would now request Dr. 𝐻𝐚𝐤𝐢𝐬𝐭𝐚𝐧 Saab to please start the formal proceeding of today's match. So over to Dr. 𝐻𝐚𝐤𝐢𝐬𝐭𝐚𝐧 Saab.
So thank you very much, Hamza. It's great to be back again. This time I'm online with you and I'm looking at a wonderful match. And I take this opportunity to first of all welcome you all to this extremely exciting third season of Pakistan Cardiac Super League, which is brought to you by Wilson's Pharmaceutical in collaboration with Pakistan Cardiac Society. So as we all know, we are here for the quarterfinal matches. It's the third quarterfinal, and it is going to be up against two teams which seem to be pretty much geared up. And I really apologize for the long wait. There was some technical difficulty going on, and the studio was trying to fix it. But now we are back in the game. And it's going to be a clash between Aga Khan University Hospital Stars versus LNH, Liaquat National Hospital Pelicans. And we are hoping for a tight game. I hope it's a nail biter because that's what we love to see. And in the end, it's all a learning event. I would also like to take this opportunity to welcome our faculty members, the dignitaries, and first of all, it's the umpires. And we will be joined by Professor Muhammad Ishaq Saab, and we have with us Professor 𝐻𝐚𝐤𝐬𝐿 Saab. So the umpires are there. They are extremely important for these matches. Thank you very much for all your support. And we will also be joined, I think we are already joined by Professor Amber Ashraf, and she's always there and extremely instrumental. And we will introduce the dignitaries as they join us, if we have more of them. So with this, I will request everyone to keep their mics muted, please, because I think there is some crosstalk going on. So everyone muted, whosoever is talking, his or her mic should be unmuted, rest should be muted, so that we can have a comfortable game and it's easy on the ears as well and we can understand each other. Okay, so are the two teams ready? So let's move towards Aga Khan University Hospital Stars. Where are the stars? I do see the stars.
Yes, we are here. Assalamu alaikum.
Walaikum assalam. So the captain to go ahead with the introduction.
So my name is Dr. Hassan Mahmood, Chief Resident Adult Cardiology here in Aga Khan University. I'm the captain. This is my team.
Okay.
Assalamu alaikum. This is Dr. Anna, final year cardiology.
Assalamu alaikum, Dr. Fahad, final year cardiology resident, and our fourth team member, she's busy in a case, in an emergent case, she'll join shortly. But we can start.
Walaikum assalam stars. So I do see a lot of experience there. पढ़ाया तो आपने काफी लोगों को हुआ है. So you are up against the underdogs, I believe. Okay, let's see what the underdogs do. Have you labeled them with being underdogs? Okay, so moving to the Pelicans. Liaquat National Hospital Pelicans. Captain,
my name is Dr. Noman
you
Ahmed.
have the introduction, please.
So my name is Dr. Noman Ahmed. I'm Chief Resident Cardiology, Liaquat National Hospital. And my teammates.
Assalamu alaikum. I'm Dr. Fiza Javed, final year cardiology resident.
Assalamu alaikum. My name is Dr. Abdul
Okay.
Assalamu alaikum, Dr. Nida Batul, final year cardiology.
Okay, so welcome to both the teams, the Pelicans and the Stars. And best of luck to you both. I think Aga Khan University Hospital Stars are shot by one of their colleagues, and I guess they're busy in some case there, but that's all right. I think we do have to start the show, as already there is quite some delay that has taken place, and we have to get things going now. Okay, so we have the pitch report and the weather. So I think the weather looks pretty good. Sun is shining bright. The pitch, it's a good bouncy wicket. I'm expecting a good score from both the teams. And I'm wishing both the teams best of luck. And with this, I'm going to move towards the coin toss. And it's going to be electronically done. So can we have it on the screen, please? Okay. And I'm randomly going to ask one of the teams, okay, Pelicans, what do you want? Heads or tails?
Tails.
Roll the coin, please. And it's tails. Okay, so again, I guess the luck could have gone either ways. And Pelicans have actually won the toss. All right, so I'm going to put you forth with two questions. The first one, do you want to take the questions or you want to throw the questions?
So I think AKU Stars will answer first and then we will answer after them. Throw the
Okay,
question.
so you want to answer second?
Yes, exactly.
You want to answer second, right?
Yes, exactly, yes.
Okay, hold on a minute. Hold on a minute. I'll have to get back. Okay, so they'll be throwing the questions. You want to be throwing the questions first. That's what you mean.
Yes.
Okay. So they want to throw the questions first. Now, the second part is you want to select scenario A or scenario B.
So scenario A.
Scenario A. All right, so they've picked scenario A, and the news from the center is Pelicans have won the toss, and they want to throw the questions, and they have selected case A. All right, so best of luck to both the teams, but just hang on a minute because I need to get back and I need to get the screen back on. I've lost the screen on my laptop. Just hold on for a minute. Technical team, I think I may have to reconnect, but because somehow I can't see the main screen here.
डॉक्टर हमजा, इस टेक्नोलॉजी के मजे भी बहुत हैं और कुछ कुछ
Downsides
नुकसानात
भी हैं
भी
मैडम,
हैं। Please
बहुत
जी,
नुकसानात है मैडम, ये हमें अंदाजा है. Okay, I may have to.
इंशाल्लाह ठीक हो जाएगा, don't worry.
I may have to join in again. Just hold on, hang on a minute. Okay, so I'll be joining in back. All right, so I am back. That's wonderful. I've got the screen as well. Okay, so we already know that Pelicans have won the toss. They want to throw the questions and they selected case series A. So can we have the first case on the screen? Yes, that's the scenario, and Pelicans, go ahead and read it.
So 48-year-old man presents with a 2-day history of sharp pleuritic chest pain radiating to both shoulders. So the pain improves when he sits forward and worsens when lying supine. He has a low-grade fever but no significant past medical history. So on examination, there is a scratchy 3-component sound at the left sternal border. The ECG shows diffuse concave ST segment elevation in most leads with PR segment depression and reciprocal PR elevation in AVR. So high sensitivity CRP and ESR are elevated. Transthoracic echocardiography reveals a small circumferential pericardial effusion without evidence of tamponade. He denies recent travel or TB exposure. So you are asked to confirm the diagnosis, assess risk, initiate treatment, and counsel the patient about prognosis and recurrence prevention.
Okay, so you can take a few seconds to gather yourselves, Aga Khan stars, and once you're ready, we will move ahead to the questions.
Let's proceed with the questions.
Okay, that's wonderful news. Aga Khan stars are ready. All right, bring the first question and read it, please, Pelicans, along with the options. Pelicans,
So
you'll have to unmute.
And otherwise, healthy middle-aged man presents with pleuritic chest pain and diffuse concave ST segment elevation but has no pericardial effusion and a normal troponin level. According to ESC diagnostic criteria, which combination of findings is required to diagnose acute pericarditis in this setting? So option A, elevated CRP alone and fever greater than 39 degrees Celsius. Typical pleuritic chest pain, pericardial friction rub and characteristic ECG changes. Option C, isolated PR depression without ST elevation. Option D, large pericardial effusion and elevated troponin. And option E, normal inflammatory markers and chest pain relieved by nitrates.
All right, your timer starts now, 60 seconds.
आइसोलेटेड के साथ सिर्फ ECG चेंजेस पे नहीं कर सकते हैं, तो हमें वो भी चाहिए और वो भी चाहिए. So I think let's go with B, beta.
B beta. Are you sure about it, stars?
Yes.
They seem to be pretty sure. They've come down the wicket, going over long off. Lock B beta then. And that's the right answer. Great start. Wonderful. That's what we expect from this great quarterfinal. Brilliant, brilliant. All right, moving to question number 2 on your screen.
The Question number 2. Pericarditis can mimic early repolarization and acute ST elevation myocardial infarction on ECG. Which of the following ECG patterns is most characteristic of acute pericarditis and help differentiate it from acute coronary occlusion? So option A, convex dome-shaped ST elevations confined to leads V1 to V4. Option B, ST segment elevation with concomitant ST segment depression in leads 2, 3 and AVF. Option C, diffuse concave ST segment elevation with PR segment depression and reciprocal PR elevation in AVR. Option D, Q waves and evolution of T waves inversion in a coronary distribution. So option E, high voltage QRS complexes with narrow PR interval.
All right, the timer is all yours. You have 60 seconds.
तो बाकी सारे ऑप्शंस तो आपके so let's go. So we'll go with C, cat.
C, cat. Are you sure? You want me to lock it? Okay, Jayasuriya is on the go again, down the wicket, going over. Extra cover this time. Lock it. Lock. You want me to lock C?
Yes, C.
C, Charlie, lock it. And that's another 6. Wonderful answer. Great going. You seem to be on fire, and you're also on a hat-trick of 6s. Let's see what happens. Mostly I've been cursing people by this. Let's see whether the curse is strong enough for you or not. Okay. Okay, so good luck to you. And you have question number 3 on your way.
So question number 3, in contemporary ECD guidance, patients with acute pericarditis are triaged based on high-risk features. Which of the following constitutes a major independent risk factor mandating hospital admission and extended evaluation? So option A, age less than 60 years and fever less than or equal to 38 degrees Celsius. Option B, pericardial effusion measuring less than 10 mm and good response to NSAIDs within 1 week. Option C, immunosuppression, for example, on chronic steroids or trauma. Option D, cardiac tamponade, high fever greater than 38 degrees Celsius or large pericardial effusion. Option E, elevated CRP.
All right, 60 seconds coming your way.
अच्छा तो हाईएस्ट रिस्क तो हमारा मेरे ख्याल डी पे ही बनता है
लेस देन 60 और फीवर तो निकाल दो इफ्यूजन बहुत कम है सही भी हो रहा है दाखिल क्यों करोगे वेस्ट ऑफ मनी immunosuppression is not a indication for admission elevated CRP could be in anything D is the only sensible option
so we'll go with D delta
D delta. Okay, so much of camaraderie going on in this team. They're really discussing it beautifully. I'm not sure. Let's see what happens. Lock D delta. And they are superb. A hat-trick of 6s. Wonderful, wonderful. So that's quite cheeky, but I know when you're prepared, you can take your chances. Well done, Aga Khan. Great going so far. And with this, we move to question number 4.
So question number 4, evidence-based therapy for idiopathic or viral pericarditis aims to control inflammation while minimizing recurrence. In the absence of contraindications, which pharmacological regimen is recommended as first-line therapy? So option A, combination of high-dose corticosteroids, more than 1 mg per kg and colchicine. Option B, immediate pericardiocentesis followed by intravenous antibiotics. Option C, NSAIDs, ibuprofen 600 to 800 mg 3 times daily plus weight-adjusted low-dose colchicine. Option D, long-term oral anticoagulation and bed rest. Option E, intravenous heparin and beta blockers.
All right, 60 seconds coming your way again. Seem to be excited. Let's see what happens.
So we're going with C, cat.
AB, are you sure about it? AB de Villiers.
Yes. C, Charlie.
Okay. He says C, Charlie. He's so sure about it. Lock C, Charlie. And obviously, he's right. Very well done. Superb. Brilliant answer. So that's wonderful start. That's a wonderful start by the stars, and they are really shining like stars at the moment. Great going. Well done. Moving to question. Mashallah, madam. That's for sure. And madam is excited, and we all are. Great going. Question number 5.
So question number 5. A 30-year-old woman presents with acute pericarditis at 10 weeks gestation. NSAIDs other than aspirin are generally avoided in the first trimester. Which anti-inflammatory regimen is preferred in her situation? Option A, aspirin 500 to 1000 mg every 6 to 8 hours plus colchicine 0.6 mg twice daily. Option B, diclofenac 100 mg twice daily without colchicine. Option C, naproxen 1000 mg twice daily plus colchicine 0.6 mg twice daily. Option D, high dose prednisolone 1 mg per kg per day for 3 days. And option E, ibuprofen 800 mg 3 times daily plus oral warfarin.
And you have 60 seconds to answer this.
वो उसने ऊपर स्टेप नहीं किया कि वो दे नहीं सकते, तो बी लेकिन और ई तो वैसे ही निकल गया, ऑप्शन बची ए और डी की।
और प्रेडनिसोलोन फर्स्ट डे 3 डेज में देके हमने क्या वो कर लेना,
एक करो मतलब ए वुड मेक सेंस बिकॉज़ बट एस कार्ड कब देते हैं आपको आंसर?
एस कार्ड तो वैसे भी देते हैं ना जो गेस्टेशन।
डू यू हैव अ 50-50 ऑप्शन, चूज द लाइट लाइन?
I wish you had that, but we don't.
So
26 seconds, come on. AB, don't be stuck, come on.
We're going with A alpha.
Colchicine NSAID नहीं है।
Okay, you want me to lock it? A alpha?
Yes, lock it please.
How sure are you this time? So A alpha, you want me to lock it?
Yes, lock it.
Lock A alpha, let's see. And brilliant. Beautiful play. I think the way you are deciphering the codes, brilliant play. Well done. Great display of rationality, sensibility, and obviously knowledge. Great going. Pelicans, you have to buckle up too. Okay, halfway through, and they've struck sixes on all the deliveries. Beautiful play. Question number 6 coming your way.
So question number 6. The risk of evolving to constrictive pericarditis varies according to etiology. Which underlying cause carries the highest risk of progression to constriction and often warrants early consideration of pericardiectomy? Option A, idiopathic viral pericarditis with small effusion. Option B, recurrent pericarditis managed with colchicine. Option C, purulent or tuberculous pericarditis. Option D, myopericarditis with normal troponin. Option E, pericarditis associated with autoimmune thyroiditis.
Start the timer, please.
वायरल पेरिकार्डिटिस
ये सेल्फ रिजॉल्विंग होता था।
स्मॉल रिकरेंट है, उसके लिए तो पेरिकार्डियोटमी करोगे, कंस्ट्रक्टिव थोड़ी हो रहा है अभी तक। प्यूरलेंट ट्यूबरस, ये सब सबको पता है, कंस्ट्रक्टिव जो फाइब्रोसिस सबसे ज्यादा होता है, मोस्ट कॉमन टीबी है। मायोकार्डाइटिस विद नॉर्मल ट्रोपोनिन, क्यों तुम इस तरह तो हर तीसरे बंदे की तो बायोप्सी करने लग जाओ। ऑटोइम्यून सी लॉक
मेरे ख्याल में
highest would be C then.
हाईएस्ट रिस्क आई थिंक सी में ही होगा। So let's go with C, Charlie.
Okay, you want me to go with C, Charlie? Oh my God, I'm in trouble
Yes.
this time. C, Charlie. Let's see what happens. I hope you get it right. Yes! So, meal is on whenever I'm in Karachi. It's on me. That's for sure. And I will be there for you guys.
Great.
Brilliant play.
और मुझे बता के कराची जाए, मैं भी आपके साथ हूँ।
Madam, you are most welcome. It is so exciting to see the way they are doing it. It's actually not how you do it, it's the way you do it. Brilliant display of knowledge.
Great.
And excitement is on. Wonderful, wonderful. And I'm sure Pelicans are also going to come hard at you. They are a wonderful team. You may have taught them a few things, but at times, you know, they can come up with the goods. So let's see. Yeah, I know. So, all right. Okay. Can we have the next question with all the excitement?
So question number 7. The ICAP trial compared colchicine versus placebo in addition to standard anti-inflammatory therapy for a first episode of acute pericarditis. What relative risk reduction in incipient or recurrent pericarditis was observed with adjunctive colchicine? Option A, 25% relative risk reduction. Number needed to treat NNT is equal to 8. Option B, 56% relative risk reduction NNT 4. Option C, 75% relative risk reduction NNT 2. Option D, no significant reduction NNT greater than 20. Option E, increased recurrence compared with placebo.
All right, you have 60 seconds, and I do see the Chinaman Paul Adams bowling
उन्होंने
here.
ना गाइडलाइन में फर्स्ट लाइन कर दी है, तो वो उसके लिए सिग्निफिकेंट रिस्क रिडक्शन होनी चाहिए।
56 का मतलब ये कि
56 या 75 doesn't make sense, but still.
गलत है। मैं आज
Number needed to treat 8 would be ज़्यादा.
Okay, Aga Khan, are you there?
Got hanged. We are here. We are here.
speechless.
What do you think? A या B?
26 seconds now.
I would go with
A.
A.
Okay.
25 यार.
56 और 75 is a big number.
16 seconds.
We are going with A alpha.
ये गलत हो सकता है.
A alpha, are you sure?
No.
Not
Yes.
sure.
Yes.
Okay, so let's see which way it goes. Chinaman or the regular one? We don't know. Lock A alpha. Oh, that's the first miss. Oh, goodness. So that turned the other way. Well, you tried hard. You were working on it, but never mind. You still are going great guns at the moment. Okay. We're moving to question number 8. And the score is 36, just one miss. Read the question, please. Question number 8.
Question number 8. In patients experiencing their first recurrence of pericarditis, the CORP trial assessed the effect of continuous colchicine versus placebo on long-term recurrence. What was the approximate recurrence rate at 18 months in the colchicine arm? Option A 50%, option B 40%, option C 24%, option D 10%, and option E 5%.
All right, your timer starts now. 60 seconds.
18 months is 1.5 साल. तो कितना कम था लेकिन colchicine arm में? I think 50%.
That's 24
What? 24?
I don't know.
I'm split between 40 and 24.
40 is a big number. तो मैंने 18 महीने किसी को खिलाया, उसके बाद भी हो रहा है, तो पर्सनल गाइडलाइन कैसे हो सकती है? 1.5 साल कराने के बाद फिर एक दवाई में 40%.
25 seconds.
अच्छा, recurrence rate in the colchicine arm तो कम होना चाहिए, तो I think go with 24.
I don't know.
18,
24 या
17.
हाँ. I think it's
कम होना चाहिए
D or C.
Approaching 10 seconds now. Come on.
Let's go with C, Charlie.
Okay, so C Charlie. Again, it's a slow flighted delivery. Let's see what happens here. Locking C Charlie. And superb answer. I know you were not sure there, but you used your mind and you got it right. This is beautiful play. Great demonstration of teamwork. Well done. Really exciting play. So we are left with 2 more questions. Second last question coming your way. Question number 9.
So question number 9. COP2 enrolled patients with greater than 2 recurrence of pericarditis to examine the efficacy of prolonged colchicine therapy. What was the recurrence rate at 6 months in the colchicine group? Option A 65%, option B 42.5%, option C 30%, option D 21.6%, option E 8%.
And the timer starts now, 60 seconds.
18 महीनों पे 24% था. ठीक है, तो 6 महीनों पे ज़्यादा होना चाहिए.
हमारी screen हमारी small हो गई है.
क्या numbers हैं?
Okay, put the technical team, put the screen right. Okay, hold the timer, please. Hold the timer, please. Okay, we'll give yes. And put the screen right. Can you see it now, Aga Khan? I can't hear the stars. Stars, is it back?
No, the screen is still small.
Stars, okay. Technical team, are you working on it?
So there is some internet problem at Aga Khan end.
Okay. So, team on
Screen
ground,
is blurry,
can
we
you do
cannot
some...
see the options.
We cannot still see the options.
Okay, hold on. We'll give you enough time. We know there is a technical problem in terms of your internet.
हमारा उस पे लिखा आ रहा है your net.
Okay, so we do have some internet issues here, so they're working on it.
यार ये screen हमारी तरफ करें जरा.
Okay, do we have any alternate way?
We cannot see the PCL3, the question screen.
Okay. So technical team, can we give them anything in print form or on WhatsApp? What's the alternate?
Can you read the question and maybe give us the time? But थोड़ा slow पढ़ना होगा.
Because screen is still blurry.
And options भी थोड़ा आराम से करने होंगे.
So you can't see any of the options A, B, C, D, E. You can't see them.
It's very blurry, like.
We cannot read them.
It's very blurry.
Okay,
Give us an
okay,
extra
okay.
minute.
Hold on. So we have come to a halt here. Don't worry. Your timer is still at 43%. You'll get the 43 seconds. You'll get those 43 seconds, and we are trying to fix it. So we have stopped here until you can see the options clearly.
Sir, I have shared the screenshot of the question with them.
Okay, so now we can. Okay, start the timer, please, because they've been given the options.
Call to enroll patients.
Okay, so I can't hear them now. 30 seconds. Aga Khan, stars, are you there?
On kar do na. Yeah, we are reading the question now.
Call to trial.
टाइमर चल रहा है.
13.42.5. 42 तो बहुत बड़ा है. 65 भी बहुत. 62 भी बहुत बड़ा है. Yeah, it's either.
Okay, so we are approaching almost zero here. So we do have Abdul Hamid Siddiqui Saab. Sir, should we give them more time?
I think we should give them because they are still reading the question.
Yes, yes. So we'll give you.
I don't think.
Okay.
C versus D में answer है.
So we'll go with D, dog.
Okay, you want to go with D, dog. We had given you 30 seconds extra. You want to go with option D, right? D delta. And I'm going to lock D delta now. Lock it. And that's the right answer. Okay, we had some technical glitch over there, and we had to give them extra time since they couldn't read it properly, and the things were blurry and fuzzy over there. They got the options, and they have smashed a wonderful 6 over the bowler's head. Wonderful. So, Aga Khan Stars, are you there? Can you hear me? And can you
Yes,
talk
we can
to me?
clearly hear you, but we cannot see the screen clearly. It's blurry.
Okay, so how do we get to the last question then? Are we going to show them on WhatsApp, Hamza? Okay, so
last question.
It's the last question, and we'll have to move on. Hamza, how do we do this? Hamza, are you there?
Yes, sir. I've sent the question on the screen.
Okay, so all right. So we are going to move to question number 10 now. All right, question number 10 coming your way. Read it.
Question number 10. Rhapsody was a phase 3 trial of the IL-1 trap. Ylona said
the screen is stuck again.
No, not like this. Not like this.
Okay, hold on. But you have the question on the phone, don't you? Hold on. Just don't read it now. Hamza, do they have something there to read it from? Aga Khan Stars.
Sir, I've sent Numan on Numan Wasia's mobile. Numan, please give them the...
Numan, could you kindly give them your mobile? Okay, so you have the phone now and you can read it. Okay, so I'll request Pelicans to read the question now. Please read it.
So question number 10. Rhapsody was a phase 3 trial of the IL-1 trap, rilonacept, for refractory recurrent pericarditis. Which statement accurately summarizes its primary outcome and clinical implications? So option number A, rilonacept tailed to reduce recurrences and at high rate of hepatotoxicity. Option B, rilonacept was only effective in patients with concomitant myocardial inflammation. Option C, rilonacept was inferior to colchicine and increased hospitalizations. Option D, rilonacept reduces recurrences but could not taper concomitant steroids. Option E, rilonacept significantly reduced recurrent episodes, 7.7% versus 74% with placebo.
All right, your timer starts now. 60 seconds. Let's see what they do with this last question, the last delivery of this first innings of this third quarterfinal of this third season of Pakistan Cardiac Super League. Okay, so you have 30 seconds now. Stars, can you post a defending total here? 20 seconds. 17. 12, come on.
कम करेगा यार, reduce तो करता है.
8 seconds. 7.
एक ही option में reduce हो रहा है.
D.
Which one?
We'll give it E. Elephant.
Okay, so they said E, elephant, just at the last moment in the nick of time. And I'm going to lock option E. Lock it. And that is the right answer. Superb performance. Brilliant play. Wonderfully done. What a great stroke in the end. And I think that was over the keeper's head for a 6. Wonderfully done. Superb. Wonderful performance. I think this is brilliant stuff. And that's superb. All right, so with this we come to the end of this first innings. And Aga Khan Stars are excited. I'm sure Pelicans are geared up as well. And they've put up a great total for the quarterfinals here. It is a score of 54 and they've just missed one question. That means, Pelicans, you've got your hands full and you have to play each and every delivery very carefully. All right, but best of luck to both the teams. With this, I move to our umpire, Dr. 𝐻𝐚𝐤𝐬𝐿 Siddiqui Saab. Sir, your thoughts today?
I think very well played by AK Stars. They have put a very fighting score. So let's see the response of the Pelicans.
Yes, it was pretty crisp from him, and you've done a wonderful, you've put up a wonderful show here. Great performance by you, and I think we need some comments from Professor Amber Ashraf. Ma'am, your thoughts, please, so far.
Thank you very much. That was a wonderful game. And especially your commentary make it so excited, and they really are very well prepared for the question answers. Salute to them, their supervisors. We have really enjoyed it. And the second team, please be attentive. You can win. Okay? Still there is a chance to have it. Go ahead, G. Thank you very much.
Thank you very much, ma'am. I think this was, again, some great words from you. And we know that Pelicans can do it because I've seen 10 on 10 twice this season. So you never know. Pelicans may just, come out with a blinder. So, Aga Khan, I hope you're also geared up for Pelicans. And Pelicans, best of luck to you. In fact, best of luck to both the teams. And I really need to thank you for putting up this wonderful performance, Aga Khan Stars, and I'm hoping that Pelicans are going to be up for the task. So with this, we move on to the second half. And can we have the case scenario be on the screen, please? The second case. And Aga Khan Stars, are you there?
Here. So case B is of with progressive dyspnea, palpitation and substernal system.
Okay, I think they're having some technical internet issue, for which I think I'll take over here and I'm going to go through the case myself. All right, Aga Khan Stars, are you there?
Yes.
Okay, so I'll read the question
Can you hear
myself.
us?
Yes, I can hear you, but I think there is some technical glitch. We can't hear you. So I'm going to read it myself. Okay?
It's fine.
Okay, so a 29-year-old previously healthy man presents with progressive dyspnea, palpitations and substernal chest discomfort occurring 1 week after a viral prodrome. His blood pressure is 95/60 millimeter of mercury, heart rate is 120 beats per minute, and oxygen saturation is 93% on room air. Examination reveals bibasilar crackles and an S3 gallop. ECG shows sinus tachycardia with non-specific STT changes. High sensitivity troponin is markedly elevated and her BNP levels, which are pro-BNP, is 4,000 picograms per ml. Transthoracic echocardiography demonstrate a dilated left ventricle with an LV ejection fraction of 30%. Coronary angiography shows normal coronary arteries. Cardiac MRI reveals global myocardial edema and patchy mid-wall late gadolinium enhancement. He is diagnosed with acute fulminant myocarditis. You are asked to manage his hemodynamic instability, evaluate for etiology, and decide on the role of immunosuppressive therapy. And I'm going to give you a couple of seconds to gather yourselves, Pelicans. Let me know when you're ready.
So, okay, please go ahead.
Okay, so they are ready with it. Can we have question number 1 on the screen, please?
When suspect myocarditis.
Okay, so I'm going to read it myself. Hold on. Pelicans, let the question finish, please. Only you start talking once we're done with the questions. Okay. When evaluating suspected... What? Who's this?
They are back. AQH are back. I guess they can read.
Okay. Okay. AQH, Aga Khan University Hospital Stars. Are you there?
Read it.
Okay, read the question.
When evaluating, so the screen is blurred again.
Okay, Hamza, it's not looking that good. Can you hand them over something so that they can read it from there?
And Dr. Hamza, can I suggest one thing? If there is an interact issue from Karachi, from 𝐾𝐤, why not with their permission, you read out the scenario so that we can manage on time? Actually, I'm in the cab with the procedures.
Yes,
but
ma'am, I'm going to do it myself. Yes, that's what I'm going to do. I think I'm going to do it myself.
If both the teams agree.
Okay, okay. So teams, are you all right with this, Aga Khan Stars?
Yes, we are fine.
Okay, so I'm going to, and Pelicans, you too?
Yes, please.
Okay, so question 1, I'm going to read it. When evaluating suspected myocarditis, which non-invasive imaging modality provides the highest diagnostic accuracy for detecting myocardial inflammation and necrosis, and relies on T2 weighted edema imaging combined with late gadolinium enhancement. Option A, cardiac CT angiography. Option B, transthoracic echocardiography with strain imaging. Option C, cardiac magnetic resonance imaging with T2 weighted and LGE sequences. Option D, positron emission tomography using 18F FDG alone. Option E, technetium 99M pyrophosphate scintigraphy. And your timer starts now, 60 seconds.
So option C, Charlie.
Oh, he's down the wicket and he wants to hit it for a 6. Are you sure about it?
Yes, we are sure.
He's very sure and he wants me to lock C. Charlie. Lock it, please. And yes, great answer. Wonderful start. That's what we wanted. Brilliant, brilliant. Great going. All right. With this, we move to question number 2. I'm going to read it. On cardiac MRI, the distribution and location of late gadolinium enhancement affects prognosis. Okay, I just request everyone to stay quiet, please. Yes, your mics should be muted, please. Okay, mid-wall or septal LGE has which prognostic implication? Option A, no significant impact on prognosis. Outcomes are determined solely by baseline LVEF. Option B, increased risk of all-cause mortality, cardiac mortality, and persistent LV dysfunction irrespective of LVEF. Option C, better long-term survival due to robust inflammatory response. Option D, predicts resolution of myocarditis within 2 weeks without therapy. Option E, indicates absence of active inflammation and favorable prognosis. 60 seconds are on your screen.
Distant LV. B होगा ना? B for ball. क्या हुआ? हाँ ये थोड़ा इशू है, increase risk of all कभी on cardiac prognosis B कर दूँ B कर दूँ beta so that's one. Increase risk of all.
Okay, you have 20 seconds now. Come on.
So we will go
Play
with
wisely.
B beta.
Are you sure about it? You want me to go with B?
Yes, we are sure.
B beta. Okay, Pelicans, I'm locking B beta. Lock it, please. And that is the right answer. Superb, superb stuff. Great stroke and over the bowler's head again. Superb. Wonderful. This is what we want. Okay, moving to question
Thank you, sir.
number 3. Yes, and I'm going to read it for you. Endomyocardial biopsy is reserved for selected high-risk scenarios in suspected myocarditis. According to ESC guidelines, which clinical presentation warrants urgent biventricular biopsy? Option A, young patients with stable symptoms and preserved LVEF. Option B, LVEF of more than 50% and isolated chest pain. Option C, fulminant myocarditis with hemodynamic compromise or refractory ventricular arrhythmias despite standard therapy. Option D, asymptomatic troponin elevation after influenza infection. Option E, mild viral myocarditis responding to NSAIDs alone. And you have 60 seconds.
So C लग रहा है ना वैसे C होगा ना so we will go with C Charlie.
C Charlie. So you still have 45 seconds. You've come down the wicket and trying to go over cover. If Ishaq Saab was there, he would not have been so sure about it. You still want me to lock C Charlie?
Yes.
Okay. I'm going to lock C Charlie. And C lag raha hai aur C hi hai. Beautiful, beautiful answer. And this is great confident play once again. You guys are more quiet, but then, you're coming up with the right answers. Okay. And stars are also on the edges of their seats, respective seats, that is, and you're giving them a tough competition. That's what we are looking for. Great going. Okay. And I really want this to be a nail biter. Okay. Question number 4 on your screen now. A patient with fulminant myocarditis deteriorates despite optimal medical therapy and requires escalating support. Which management strategy is best for cardiogenic shock? Option A, standard heart failure therapy plus consideration or mechanical circulatory support. Option B, high-dose beta blocker therapy and exercise restriction. Option C, intravenous thrombolysis. Option D, immediate implantation of ICD. Option E, long-term imidazole without hemodynamic support. And 60 seconds coming your way.
तो D तो नहीं होगा ना D हाँ नहीं है ICD ना कोई वो ये ना EF कम है ना कोई एरिथमियाज हुआ है कोई एरिथमियाज नहीं है बीटा ब्लॉकर तो नहीं रहेंगे पहले शॉक में है वो तो नहीं करेंगे हाँ बस तो A है ना A अल्फा कर दूं so we will go with A alpha.
A alpha. So they've taken a few steps. It's a full toss, I guess. Let's see whether it goes over the boundary or not. You want me to lock A alpha?
Yes.
Okay, lock A alpha. And it's a 6 for sure. Well played, but I think you got it well.
Great.
And definitely, I think ma'am wants to say something.
It's great. We are enjoying it.
Yes, ma'am. I think they are actually fighting it out and they are trying to get close to this total, which I think they may. And then we'll have a nail biter. Okay, a nail biter in the making, hopefully. But you still have to go a long way and you have to play wisely. So the team coming into play now, team action is going on. They are discussing things, which is good. All right, best of luck again to both the teams. We are moving to question number 5. And here it is. So sudden
Sir,
cardiac death. Yes, Hamza. Hamza. Okay, I think we heard
So
Hamza.
I have to read? Okay.
Okay, you can read if you can.
So question number 5, sudden cardiac death can complicate myocarditis. Which statement best reflects current recommendations on temporary versus permanent device therapy? Variable cardioverter slash defibrillator and ICD in acute myocarditis. Option A, ICD should be implanted at presentation in all patients with LVF less than 40%. B, ICD implantation is contraindicated in the setting of myocarditis. Option C, permanent pacemaker is routinely implanted to prevent heart block. C, variable cardioverter defibrillator may be considered in high-risk patients, whereas ICD implantation is generally deferred for 3 to 6 months unless sustained VT or VF occurs. E, all patients require biventricular pacing.
All right, 60 seconds are on the screen now.
वो तो हो गया ना आप कह रहे हैं आईसीडी इम्प्लांटेशन कॉन्ट्राइंडिकेटेड क्यों भाई कॉन्ट्राइंडिकेटेड क्यों कॉन्ट्राइंडिकेटेड तो कुछ ऐसे नहीं एब्सोल्युटली कॉन्ट्राइंडिकेटेड क्या नहीं तो अगर बहुत कम है ये बहुत कम है एरिथमी हो रहे हैं तो आपने डालना ही है ना ये मुझे तो डी डेल्टा हाँ क्लास 3 तो नहीं है ना मुझे तो डी डेल्टा लग रहा है परमानेंट पेसमेकर रूटीनली इम्प्लांटेड भाई ये डी डेल्टा ही है डी वैसे पढ़ लेते हैं वेयरएज कार्डियोवर्टल variable cardioverter defibrillator may be considered in high risk patients. ICD implantation general deferred
25 seconds.
Unless delta. So we will go with D delta.
Okay, D delta. You seem to be pretty sure about it.
Yes.
Okay, we are going to lock D delta and let's see. Oh, we are only seeing sixes at the moment. It is sixes galore, as I would put it. Wonderful. So you've actually hit the 5th one in the row, and that takes you to a score of 30. We are done by half, and it's the halfway stage in your innings. So it's 5 out of 5 and a score of 30. Another 5, it's your game. Another 4, we may go into the eliminator. So let's see what we end up with. It's great going. Well done. And you also have your second hat trick. I don't want to jinx you, but let's see. Question number 6. Stars, read it, please.
So next question. In virus-negative autoimmune myocarditis confirmed by endomyocardial biopsy, which specific immunosuppressive regimen has been shown to improve LVEF, reduces LV volumes and ameliorates symptoms? A, high-dose NSAIDs plus colchicine. B, interferon beta therapy alone. C, single-agent mycophenolate mofetil for 1 week. Intravenous heparin followed by warfarin, or prednisolone 1 mg per kg per day with azathioprine.
Start the 60 seconds.
D होगा सही मुझे लगता है चार्ली होगा शायद D तो कभी नहीं होगा D आप हटा दें अलोन वाला B है B भी हटा दें बीटा भी हटा दें आप सही है A भी नहीं हो सकता और E तो लेस लाइकली है या C है या E हाँ वो E हाँ prednisolone with azathioprine 2 mg per kg per day. अच्छा तो वैसे ऊपर 1 वीक है तो 1 वीक नहीं होगा ना थोड़ा लंबा ही देना पड़ेगा आपको ई कर लूं फिर ई कर लूं ई कर रहा हूं फिर मैं सही सो ई elephant
E elephant. Okay, you want me to lock it?
Yes.
Okay, he's saying lock E elephant. Let's see if it's the elephant or not. Lock it. It's a big elephant. Beautiful, and it's a 6. Wonderful. It's been flicked over the square leg boundary. What a stroke. And you see this time around, this wonderful way of dealing with it. I think the teamwork and the way they were actually ruling out the options and coming up with the answer. They've taken a leaf out of Aga Khan Star's book actually, and this was wonderfully done. Beautiful play, and that actually takes you to 6 in a row, so 2 consecutive hat tricks. Wonderful, wonderful. And the best part is they are matching Aga Khan Stars ball by ball, and it is head to head up till the 6th question. Beautiful. That's what we wanted to see, and I'm so excited for this next question, which is question number 7, and I'll request the stars to read it.
So next question. TIMIC was a double-blind placebo-controlled trial of prednisolone plus azathioprine for biopsy-proven virus-negative inflammatory cardiomyopathy. Which outcome was observed after 6 months of therapy? A. No difference in LVEF and most treated patients required heart transplant. B. Treated patients had 30% higher mortality rate due to infections. C. LVEF improved markedly in 88% of treated patients. D. Only biopsy-proven giant cell myocarditis responded to therapy. E. Immunosuppression increased viral replication and worsened outcomes.
And you have 60 seconds now to answer.
Improved in 88% of treated patients. Yeah. No difference तो नहीं हो सकता हाथ जोड़ दें हाँ ये भी बहुत हाँ ठीक है ऑन डी क्या है ओनली बायोप्सी प्रूवन जायंट सेल मायोकार्डाइटिस responded नहीं होना चाहिए तो फिर सी सही है ठीक है हाँ टाइम है वैसे भी थोड़ा सोच लें treated patient at 30% ये भी तो नहीं होगा वो भी treated patients सी होगा ये सी लग रहा है सही है ना कर लें
You have 20 seconds. You know, the 7th question is always the difficult one in this match because they also got it wrong. Stars.
C.
Come
Charlie.
on, 10 seconds.
C. Charlie.
C. Charlie. How sure are you about this?
100%.
He's saying 100%. So lock C. Charlie. Oh, yes! Turns out this was not the jinx question for them and they've gotten it right. 7 out of 7. Goodness me. What's going on? Great response from Pelicans. Oh, they are in striking distance now. Aga Khan, I think we have a match. All right. 3 questions. Smiles all around and excitement as well. Well, best of luck to both of you. You've been brilliant, honestly. Okay. Can we have question number 8 on the screen?
So next question, the landmark myocarditis treatment trial evaluated cyclosporin or azathioprine plus prednisolone versus placebo in unselected adults with myocarditis. What did this study conclude? Significant reduction in mortality in heart transplantation with immunosuppression, early improvement in symptoms but late increase in arrhythmic deaths, improvement only in patients with positive viral PCR, D. Beneficial effect of IVIG on LVEF, E. No overall benefit of immunosuppression therapy.
And you have 60 seconds now.
Versus placebo. Significant reduction in mortality and heart transplant. Early improvement symptom. Late तो नहीं होने चाहिए. Improvement only symptom with on LVF. No overall. यही होना चाहिए. Time really देखने. Significant reduction in mortality and दोबारा पढ़ लें देखने ना भाई cyclosporin plus versus placebo है कुछ नहीं है significant reduction in mortality and heart transplantation with immunosuppression significant reduction in mortality and transplantation early symptom भी नहीं है ना बाद में arrhythmia क्यों ज्यादा होंगी ए कर लें so
come on Pelicans
we will go with A alpha.
A alpha. You want me to lock it?
Yes.
Oh my God. Lock A alpha and let's see what happens. Oh my God. Okay. So Aga Khan is back. Goodness me. We were actually hoping for a tight finish. It is getting closer and closer and they've missed their first delivery. Okay, so now you've just got 2 more questions. You have to get them right, Pelicans, to go for a tie and then we'll have the eliminator. Oh my God. Okay, we are moving to the second last question, which is question number 9. If we don't go into the eliminator, that is. Okay, question 9. Read it, please.
So next question, in a landmark clinical trial, 𝐾.𝐍. and colleagues randomized patients with dilated cardiomyopathy and myocardial HLA overexpression to prednisolone plus azathioprine or placebo. At 6 months, what proportion of patients improved in the immunosuppression arm compared with placebo? A 10% in immunosuppression group versus 0% in placebo, 20.9% versus 71.8%, more improvement in the placebo group, 71.8% versus 20.9%, more improvement in immunosuppression group, 50% versus 50%, and elephant is 100% improvement in both groups.
All right, 60 seconds, Pelicans. You have to play smartly here. Be watchful.
हाँ ना नहीं मैं एक एक ही बात कर रहा हूँ 10% वर्सेस 0% मैं ये कह रहा हूँ ये क्यों नहीं है हाँ तो क्यों होगा वो इम्प्रूव का कह रहे हैं ना पेशेंट इम्प्रूव इन द इम्यूनोसप्रेशन आर्म कंपेयर्ड विद प्लेसिबो तो प्लेसिबो में क्यों इम्प्रूव होना चाहिए वो नीचे तो ये है कि 71% वर्सेस 21% प्लेसिबो वाले इम्प्रूव हो गए हाँ ये थोड़ा वो है हाँ और इम्प्रूवमेंट इन
25 seconds.
बेटर लग रहा है सी वाला सही है डॉक्टर ने तो सही so C Charlie.
Okay, so you want me to lock C Charlie. So you are all convinced on the C Charlie, seems like?
Yes.
Okay, they say ittifaq mein barkat hai. So we'll see lock and we're locking C Charlie. Let's see, fingers crossed. And yes! Superb answer. Brilliant play. Ittifaq mein waqai barkat hai. Bhai, great answer. Wonderful. What a match. Now, I'm moving to the last question if we don't get into the eliminators. And if you get it right, we are into the eliminators. If Pelicans, you get it wrong, then Stars will get into the semis. All right. One question making all the difference here. Okay, question number 10. Read the question, please.
So next question, 20-year follow-up of the TMIC cohort assessed durability of immunosuppression therapy. Which of the following describes a long-term outcome? A. Continued benefit with sustained improvement in LVF and NYHA class in that treatment group, whereas placebo patients showed persistent or worsening LV dysfunction. B. Regression of benefit with eventual convergence of LVEF between groups. C. High incidence of malignancy in the immunosuppression arm. D. Recurrence of myocarditis in all treated patients after 1 year. E. Development of constrictive pericarditis in more than 50% of treated patients.
All right, you have 60 seconds to answer. Best of luck to both the teams.
Continued benefit with sustained improvement in EF. Regression of benefit with ये तो नहीं हो सकता. High incidence of malignancy अब ये possible है. In all treated patients ये तो नहीं. Continued वो क्या चीज? Constrictive pericarditis. Development of constrictive pericarditis is greater than 50%. 50% बहुत ज्यादा है ना. मुझे तो A लग रहा है. Continued benefit with sustained improvement in EF and NYHA class in the
22 seconds to go.
यही हो. मैं जा रहा हूँ. A
15 seconds.
A alpha please. वही सही है. देख लो यार. So A alpha.
You want me to lock A alpha? Sure?
Yes.
Okay, they are saying they are sure. And we are going to lock A alpha. And let's see. Lock it. Oh, yes! Oh, my God. Superb answer. And what a match. So,
Great.
this was something that we wanted. Ma'am, we are into the eliminators now.
Exactly. Great.
So, Professor Amber Ashraf, she is excited. I'm sure Abdul Hamid Siddiqui Saab must be extremely happy to see this. Ecstatic, I would say, if he's there. What a performance. So, with this, we've now come to a super over, as we call it, an eliminator. So, Hamza, where are you? I think we will have the eliminator and they'll let us know. Okay, so are we ready with the eliminator questions? Whichever team is going to drop the question, obviously they'll be out then. Okay, sudden death. And who's going first here? Who's throwing the question first? Is it going to be Pelicans in the same sequence? Okay, so we are going to follow the sequence. All right, we're moving to the case. And we are moving to the question. Pelicans, you have to throw this 11th question. Can we have it on the screen? Okay, read it, please.
So question number 11. In the randomized withdrawal of air trip study of anakinra versus placebo for colchicine-resistant steroid-dependent recurrent pericarditis, which of the following best describes the relapse rate over 14 months? Option A, relapses occurred in almost all patients randomized to anakinra but not in those assigned to placebo. Option B, relapses occurred in 9 of 10 placebo patients versus 2 of 11 patients receiving anakinra, demonstrating benefit of IL-1 blockade. So option C, anakinra increased the median time to recurrence but did not reduce the number of relapses. Option D, anakinra was associated with severe neutropenia in all patients. Option E, no difference in relapse rate was observed between groups.
And you have 60 seconds to answer. Okay, there is some
A तो नहीं हो
reverse swing
सकता.
now.
A
The
तो नहीं
ball
हो
is going to swing.
सकता. B हो सकता है. हाँ हाँ, E भी एलिमिनेट कर दो. तो आई थिंक B C D में से कोई है. B और C. Is it? तो B
25 seconds to go.
ज़्यादा लग रहा है. 9 to 10 placebo patient versus 2 to 11 patient receiving anakinra.
15 seconds.
15 seconds हैं. What do you
10
say?
seconds now, come on.
Let's go with
8, 7, answer. 4.
Let's go with B, beta.
B beta. So just at the second last second, they say B beta. And I'm going to lock B beta and let's see. Lock it. Oh, superb answer. What an answer. Brilliant. How did you get it right? Oh my goodness. Oh my goodness. I think somehow they were able to get to the right answer. Brilliant play. That's what teamwork can do. Superb. Superb. Okay, Pelicans, buckle up. You've been doing the same stuff. So what makes you think you can't do it? Let's see. Can we have the next scenario for them? Okay.
So in children with acute dilated cardiomyopathy attributed to viral myocarditis, IVIG has been studied. What did the randomized double-blind IVIG trial demonstrate regarding ventricular function? A. IVIG produced significant improvement in ventricular fractional shortening compared with placebo. B. Both groups improved over time, but IVIG did not augment improvement. There was no significant difference in left ventricular fractional shortening at 6 months. C. IVIG therapy increased mortality and arrhythmic events. D. Only neonates benefit from IVIG. E. IVIG prevented progression to dilated cardiomyopathy in all patients.
And you have 60 seconds to answer it.
क्या हुआ है? ये लग रहा है ना. आप क्या कह रहे हैं? B क्यों? Intravenous तो फिर किसमें? Both groups improved over time, but IVIG did not augment improvement. There was no significant difference in LV fractional shortening at 6 months. IVIG produced improvement in ventricular fractional shortening. यार मुझे तो ये लगता है, पता नहीं. बताएं डॉक्टर ने तो कर दो. A पे A. यार मुझे तो ये लगता है. Both groups improved over time, but IVIG did not augment
20 seconds to go.
significant difference in LV fractional shortening. वैसे B
15 seconds. Pelicans. 11.
बताएं यार.
9, 7, 6,
So
5.
A
Come on.
alpha. A alpha.
Okay, so they were always talking about A alpha, and finally, I think they decide on A alpha. Okay, I'm going to lock A alpha and let's see. Oh my goodness, my goodness. What? So we know that this is the wrong answer now, and we also know that Aga Khan Stars, they have pulled it through. They are into the semis, but Pelicans, Liaquat National Hospital, Pelicans, what a performance by you guys. I think you were superb, absolutely brilliant, and I'm sure your opponents here, who are, I think, pretty well known to you guys, they must be excited to see your performance because we all are. And what a brilliant, brilliant performance by both the teams. They both, for me, are winners. And with this, I'm going to move to our umpire, Professor 𝐻𝐚𝐤𝐬𝐿 Saab. Sir, your
I think it's
thoughts.
a nail-biting finish. Very exciting, very good competition, and full marks to our Khan Stars. And I think not to belittle Pelican, they did very well. They put a very good fight. In the end, someone has to be winner. Congratulations to both.
Thank you very much, sir. Great performance by them, and the way the teams played today. Madam Amber Ashraf, I think you're there.
Yes,
So,
I'm here. Actually, the people have given me my birthday treat. Thank you very much. I have really enjoyed all that. It's a wonderful, wonderful, super match between both the teams. And really, I'm enjoying it because once we have started 2-3 years back, if we just recall the way the PGs are acting and their knowledge and everything, and now, mashallah, the things are improving so much. We are proud of them. Congratulations to all the supervisors, their parents, mentors, and that's what we want because you are our future. And with this, our nation will definitely outshine internationally. Thank you, Hamza, for such a nice moderation. We always enjoy it because आप इसमें जान डाल देते हो. And thank you other Hamza जिन्होंने 2 बजे मुझे मैसेज किया और मेरी कैद की बहुत लंबी लिस्ट थी, but still मैंने वो रोकी और मैंने कहा नहीं ये बहुत जरूरी है. And thank you Wilson Pharmaceutical. प्रोफेसर इसाक साहब को हम मिस कर रहे हैं. I hope कि सर कहीं अराउंड होंगे और ठीक होंगे. Congratulations to both the teams. इसमें जीतना हारना कहीं नहीं है. ये तो भाई एक मैच है और लहू गरम रखने का एक बहाना है और इंशाल्लाह इस तरह हम और नॉलेज को एनहांस करेंगे और जाके अपने पेशेंट्स पे बेटर वे में वी आर गोइंग टू अप्लाई दैट. थैंक यू वेरी मच. सुपर.
thank you very much, ma'am. I think we really appreciate your dedication because you were in the cath lab and even then you were here. And it's definitely happy birthday to you from all of us. And I think it's definitely a treat for you and all of us
Thank
here.
you. Thank you. Thank you. Jazakallah khair.
And with this, I just want to talk to Pelicans here. Pelicans, can you hear me?
Yes.
And I just want to congratulate you guys and your coaches, your mentors. You were superb. I think this is how these matches, they need to be played. And you know what? When they ask about the future is looking very bright, mashallah. Zabardast khele hain aap log. Aapki kya thoughts hain?
Thank you very much. Exactly. It was, I think, all about luck because questions were pretty much difficult in the end. But I think win or loss is the part of game. So yes.
बिल्कुल सही कहा आपने. बिल्कुल सही. So ये चलता है. You win some, you lose some. कभी आप जीतते हैं, कभी आप हारते हैं. But you know, in life, आप हमेशा, if you work hard, you always get rewarded one way or the other. And inshallah, many more rewards are coming your way. Best of luck to you guys and your mentors, your coaches. Brilliant work. Superb. And with this, I move to the winners of this match today. Aga Khan Stars, where are you?
We are here.
Okay. Quick thoughts. Well done. Congratulations to you. I think you started off very confidently. And I think the way you were working out things, it was brilliant to see. And in the end, it really got difficult for you. But somehow you got that right.
Thank you so much. The trials gave us a tough time, but we did some sixes there.
Yeah, sure. Bilkul. So, AB de Villiers, you did well as well. And I think the whole team is brilliant. So, you're going into the semi-finals. And inshallah, we're hoping for a wonderful match there. So with this, I think we're running out of time. And I am going to now beg leave, but before I go, I just want to congratulate both of you once again for such a brilliant performance. You've made our day, and
So
I
we do
think the
have
whole
Dr.
week.
Jamshed, coach of Aakan Star, with us.
Oh, yes, yes. Okay, Dr. Jamshed is there, the coach of Aakan.
Assalamu alaikum. I'm extremely proud of my
Walaikum
team.
assalam.
They did wonderful, and also very proud of the Yelenish team. They did really well. तो बस game है, हार जीत होती है, लेकिन माशाल्लाह बहुत अच्छा spirit है, और I'm really proud of all of us, all of them.
Thank you, Dr. Jamshed. We are all proud of both the teams, and we are proud of coaches and mentors like you who are actually giving so much to their trainees. Well done, and keep up the good work. With this, I think we now come to the end of this wonderful match. So it's been a great performance, and we know that Aakan Stars have actually gone into the semi-finals, and Pelicans, and they were absolutely superb as well. So with this, I would now take my leave, and till next time, until we see you in the next quarterfinal game, it's Allah Hafiz from my side. Take care.